Hello and welcome. This program is about the country. This program is about India. This is not about our individual finances. This is about what the economy should do, what the government should do to survive. This is about the bigger picture. There's so many trade-offs, so many difficult decisions that we have to take at this time. This is a time when tough choices have to be made and the country must come together. When I say trade-offs, tough decisions like should I spend more and forget about the budget deficit and don't worry about inflation? Should I just focus on saving lives today? But if I do that, will more lives die when workers are not being fed, when they lose their jobs? So there is a trade-off. But let me tell you, it has never, ever been as critical as it is now. But it is amazing, as I said, how India has come together. Even in a small way, I'll give an example. Not everybody is reading all the literature. And the literature did say that you only had to wear a mask if you didn't want to infect others and you were infected. But everybody wore masks in India. And the beauty is that now the literature says you've got to wear a mask whether you're infected or not. To protect yourself, wear a mask. Hand washing and masks together account for over 90% of safety for yourself. And a lot of people in India are wearing masks. So almost voluntarily, and people are helping each other. Of course, there are the occasional nutcases who will capitalize on this, but that's such a minority. We are looking after each other, and boy, is the world impressed. Well, let's have a look at what is different about this crisis. Let's look at the economic policy response to COVID-19. What should it be? It must be, first of all, much, much quicker than ever before. We can't sit back and think and analyze. Look how much faster it spreads. For the first 1,000 people to be infected earlier on, if you look at earlier pandemics and epidemics, they took much longer. Let's have a look at some examples. Take the example of MERS, the Middle East Respiratory Syndrome. That took 903 days for 1,000 people to be infected. That's more than 2.5 years. What about SARS? That took 130 days for 1,000 people to be infected. And this, for the first time, coronavirus just takes 48 days for 1,000 people to be infected. So the first lesson to all of us, we don't have time. Take decisions now, stay ahead of this virus, stay ahead of this enemy, and then you'll win. And we don't have the luxury of time. But first of all, let's go right across to Arvind Subramanian, former economic advisor, chief economic advisor, and now at Harvard. Thank you very much, Arvind, for joining us. I just want to ask you first, have we all understood how big this is? Or are we kind of still thinking maybe it's not too bad? What's different about this crisis?
Yeah, thanks, Prannoy. First of all, thanks for having me on the show. I think that when people think about, the economic dimensions of this crisis, our mental frames were, saying, okay, let's compare it to the global financial crisis that happened, 10, 12 years ago. Right. And this is something that's just absolutely different from that in three respects. It's much, much bigger. It's much, much more uncertain, and it's much more unusual. And let me just quickly elaborate on each of these. You've seen all the headline numbers in terms of all around the world, how quickly unemployment has shot up, how quickly vast parts of the economy have just shut down completely. But the one way of thinking about it is, the global financial crisis, there was one big shock in one country that went to the rest of the world. In this crisis, it's like every big economy has been hit very badly, and that's also transmitting to every other economy in the world. So it's like 100 shocks, not one shock, and each of that shock is probably 10 times bigger than what it was in the global financial crisis. So I think that's very big. It's also very uncertain, unlike other shocks, in I think two dimensions. One, there's the uncertainty about all this, how fast it'll spread, whether systems can handle it, etc., etc. But there's also this human dimension of uncertainty. How long can societies take all these measures that are being taken, like social distancing? Can people put up with it? If not, what is their saturation level for this? How will that pan out? How will that collapse? So that's uncertainty. The third uncertainty in terms of the response is how unusual it is. It's not a conventional economic crisis where, demand comes down or the financial sector collapses. It's a shock where, both demand and supply are affected. Not just manufacturing, but also services sectors have been affected a lot. And so part of the response is that you cannot respond too much because, basically the non-essential sectors of any economy, which could be 30, 40, 50, 60%, have to shut down for a very long period of time. Therefore, how we have to respond is not to bring up the economy, but actually to cushion those who necessarily will have to stop working in some ways. So in these three dimensions, it's just completely different from what we've seen. We're in really uncharted waters.
Right. Thanks very much. We'll just come back to you, but Arvind, you know more than anybody that to take good policy decisions, one thing is crucial, and that is what is the data you're basing it on. Now, we just divert a bit to look at the foundations of what we're getting all this data about. It's about testing, of course, but there's new information about testing. Economic policy is dependent on accurate data. And data testing is essential to see where and why and how many are affected. So let's see, testing is essential to see who, what, where, why, and how many are infected by the coronavirus. If you don't have that, you cannot have policy recommendation. Now look at this. If you have poor testing, you've got all these people who are healthy. Suddenly 2 of them get infected. Say the 2 in the middle that are gone red. Now you don't know. Let's say you haven't tested and you don't know who they are. Those 2, if they are not known and they're in society, they can infect another 800 people. 800, just those 2 if you don't know where they are and who they are. On the other hand, good testing makes such a difference. You find 2 people infected, you know who they are, you put them into a quarantine, separate them from the rest of society, and at most, those 2 will then infect only another 5 people or so, or even less maybe. Something around that. So that is the difference between poor testing and good testing and quarantine and lockdown. This lockdown that we're going through is making that kind of difference, 400 to 5, approximately. Now, it's important to realize as the everyday new developments are happening, and what's now important to understand, there are 2 types of tests for coronavirus, COVID-19. These 2 types of tests, again, what economic policy depends on, are for very different reasons. Number 1, the test for antibodies and the test for the virus itself. And they both have their own purposes, but at different times of an economic cycle. Let's see what a test for an antibody, and the lovely new tests have come out that take 20 minutes. You need a small pinprick blood sample for that. And then after you get that blood sample, it's a low-cost operation. You can almost do it at home, costs 800 rupees only, and it takes, as I said, 20 minutes. Testing for antibodies, very attractive. Testing directly for the virus itself, a little more complicated. Not very tough. You don't even need a blood sample. The first step, you just need a throat and nose swab, which can be done and should be done at your home if possible. And the new one that's come out called NAT, that's about 1800, which is relatively cheap compared to the existing testing mechanism called PCR. I won't go into what these all stand for. That's not relevant. But NAT, the new NAT, takes about 1 hour. 1800 rupees and just takes 1 hour. And PCR takes about 6 to 8 hours or something like that. So NAT is another new breakthrough, as is the new antibody testing for coronavirus. Of course, both of these have been around for other illnesses in the past. But which one is more relevant? Testing for antibodies or testing for the virus itself? And that's where the difference comes. And we must be very clear in our economic policies and all our policies that testing for antibodies can be misleading in the first 8 or 9 days of infection. And here's why. It can be great afterwards. Now let's say day 1. You have a coronavirus patient, and we'll go day 1, 2 to 3, day 4, 5, 6, 7, 8. Now, day 1, the person is infected. He or she has no symptoms, but from day 2 or 3, he can start infecting others. And he won't, even in day 4, he's infectious, but he may not even have symptoms. Symptoms start appearing in day 5 and 6. And day 7, he's still infectious, but no antibodies. The key point here is it takes 8 days from the first day of infection for your body to develop antibody. What are antibodies? They're things you create, beautiful body mechanism to fight viruses. But they take 8 days to actually develop and to appear. And so, on day 1, if you test with an antibody test, you'll see no antibodies. Day 2, no antibodies. Day 4, no antibodies. So you'll get false negatives. You'll say this person hasn't got coronavirus, COVID-19. But actually, right up to day 7, it'll keep saying he hasn't got it or she hasn't got it, but in fact the person is infected. So antibodies are only accurate after day 8 and 9 and then onwards. And then there's a very good purpose after day 8 and 9 onwards, and I'll just quickly, we'll go into it later, but after day 9, for a month or 2 or 3 or 4, you can go around testing using the antibody test and see whether a person had coronavirus, conquered it, is immune to it now, and can go back to work. So for getting back to work, the stage 2 of testing is best done after day 9 by antibody testing. But look at NAT and PCR testing. Since they look for the virus, they are accurate from day 1. You will never miss out on a person who's got it because you're not looking for antibodies and waiting for them to develop. You're looking for the virus straight. So at the early stage, at where we are now, we must go for these NAT tests, the new ones which are produced by some very well-known companies, and they are FDA cleared for emergency use, and India is taking on, fortunately, any tests that are FDA cleared. At least I hope that happens in practice. So that's the key. So finally, just to summarize, what are the advantages and disadvantages of antibody testing versus virus testing, NAT and PCR? So tests advantage and disadvantages. PCR currently being used, it's been used for a long time now. It's expensive, but in this crisis, I don't know how much we should worry too much about expenses. It takes about a day before you give your test, and it goes to a very sophisticated lab. It can't be done by anybody. It has to be very well trained. And it needs this both trained staff and a really good lab, as I just said, but it is very accurate. And what about NAT, the new one that's come out, just cleared by FDA a few days ago? This is recently approved. It's not very expensive, more expensive than antibody. Instead of say 700, 800, it's 1800. It is quick, can be done in less than 1 hour actually, but maybe with all the accompaniments it takes about an hour, but that's not much. You don't really need a very trained staff for this. Even a graduate can do it. Dr. Dang told me once that this can be done even under a tree if you want, but I think he was pulling my leg. And it's very accurate from day 1 to day 9. Now finally, if we look at the antibody tests, it is, again, many of them are recently FDA approved, so they are good technology. They're dirt cheap, relatively, 800 rupees. They're very quick, just 10-20 minutes. No need for trained staff, even less so than NAT. But the problem is false positives, false negatives in the early stages, the first 9 days, make it a big problem for a country like India, where we are trying to find out how many people, and we are at the early stages. Now, just to make this absolutely clear, let's talk to two of the most respected minds in this field. Dr. Gotlieb Kang, thank you very much, ma'am, for joining us. Your reputation goes way ahead of you. I just wanted to ask you, what do you feel in this trade-off? We are slightly at the earlier stage. What should we do with antibody versus direct virus testing?
I think you nailed it in your explanation. If you look at what needs to be done in early infection, it is very clearly we need to go for doing PCR or NAT test if we can get it. The problem right now with NAT is that it's not available, and we should be putting efforts into making sure that we can get the test. The antibody tests look really easy to do, but there is a problem with the test, not just in that they become positive only in the second week of illness, but validation of these tests is also much, much harder than validating molecular tests like PCR and NAT. So since these tests have not been around for a very long time, there is a lot of testing that needs to be done before we create an appropriate use case for them anytime early in illness. In late illness or looking to see who can safely go back to work, definitely these antibody tests have value. But in early illness, they will provide you with false positives.
Yes, false positives is the big worry. And Dr. Dang, I think you pointed this out to me right at the beginning, and it was a worry. So it's not that state governments or the center should not stock up with antibody tests, because that could be needed later. It's very important to see whether a person had developed antibodies and fought away and won against this virus. Then they are a little more immune, apparently, not 100% sure, but they can perhaps go back to work, particularly medical staff. If you use antibody, after a while, you can feel a little safer for them going back. But on which side do you, so government should stock up on them for the second stage, but we are in a very early stage. And it worries me, as you said right at the beginning, that the first 9 days you get these false positives, and you say a person is fine, but actually with the antibody, he hasn't developed antibody. So he's not fine, he's infected and infectious.
You know, you've actually, again, said absolutely the right thing. So in the last 2 weeks, I've been saying that initially the need of the hour and the need of the time is the PCR test. Because even if the single patient who escapes being tested at the early stages, as you pointed out, is capable of infecting a large number of patients. But if we immediately test, quarantine, the number of other contacts which he would have infected will be much lower. So at the moment, when the disease is in the early stage, when the infection in the early stage, the need is only a PCR testing. This is not to say that there is no utility for the antibodies test. The antibodies test will become useful only in the second week. Like, if you permit me to say so, initially after infection, it is the PCR test which starts getting positive from third day in onward. That is from the day the symptoms appear, and persists positive till about 15 days or so, and maybe slightly longer. On the other hand, the antibody test, that is IgM antibodies, they start appearing in the second week, 7 to 8 day onwards, and they continue for next 2 weeks or so, and then they also show a decline to be taken over by the IgG antibodies. Right. What I'm trying to say is that please, at the moment, the focus should be on testing the antigen. And once we feel that large number of patients have been infected, then we can simply go on to looking at the IgM antibodies, or when we feel that we are losing trace, then we can shift on to IgM antibodies. IgM antibodies will again show a very good purpose, that we can know that all those people who have developed IgM antibodies were infected. And here a very pertinent point comes, which we had discussed in the morning in a group of friends, that the front-end healthcare workers, when we check them, they may sometimes develop an incipient disease or a very low disease which may not be manifesting itself. But if you check for the antibodies the second week and you find that the antibodies are positive, they can again put back on the front. So it kind of helps us control our manpower. Right. It kind of let us know the state of immunity of the population and the seroprevalence, as we call it. And but in the first week, it has got practically no role. That's exactly what I feel, and that's what my respected colleague, Dr. Kang, has also just said.
Right. Dr. Kang, just a final thought from you. There are very good companies now producing the NAT test. Should our government go out and buy a whole lot of it so that we have the more accurate method of testing? Number one. And number two, could you tell me how complex it is to do that test? Dr. Dang, in his optimism, says just a graduate can do it. But I think once you get a PhD, you can't do it anymore. How complex is it? But shouldn't we buy it first?
So I think having the tests available, is all kinds of tests available, is a good thing. Doing PCR does require a fair degree of complexity and training, because you have to be very careful not to cause contamination of the area that you're working in. NAT tests, being more closed, are easier to do, and the antibody test is the easiest of all. In fact, in many parts of the world, people are thinking about doing it as an at-home test, which can be shipped to houses. So you can test yourself at home, similar to doing a sugar test for diabetes.
Right. Just wanted to finally ask you, in terms of the antibody tests, still stock up with that, because it's going to be useful a little later on, right?
Absolutely. Seroepidemiology is one of the key tools of public health. Understanding what proportion of the population has been infected allows you to direct public health efforts accordingly. If you look at what's happening now, there is more and more evidence that people can spread infection when they are asymptomatic or pre-symptomatic. So we will never know who has had contact with whom. And the only way to detect this at a population level is to look for the presence of a signature in the blood, which is antibodies, demonstrating that you have been previously exposed to the virus.
I'm going to ask finally one last thing to both of you. At a time like this is an unprecedented crisis. Shouldn't tests be made free for anybody, the poorest? It shouldn't be that, oh, I have 1800 rupees, I can do it, or 4,000 rupees or even 800. It's a lot of money. Shouldn't the government really subsidize these tests? It's not going too far. We say we put our medical frontline people first. Surely that's the first thing we should do.
Here I would like to add one thing in addition to what Dr. Kang has said, that antibody tests are very useful for hotspot areas. That is like what happened in the area close to Nizamuddin. In the Harvey slums, we had one death who was of patient who was infected with particular virus. Now in that area, in those places, we cannot have samples being collected from there or the patients being called from there. In those areas, antibody in the hotspot areas as we define, we still have to fully define what the hotspot areas are, as we are still early in the phase of the disease. Those patients in those areas can be checked for antibodies. If antibodies are positive, then they can be tested for the presence by the PCR for the presence of the antigen. If they're negative, they can be immediately quarantined. Now coming to the second part, whether these tests should be made free or not. Yes, these tests should not only be made free, but made freely available. Because at the moment, as again, I'll say that the testing capability is there, the testing capacity should be enhanced. There are equipment in the world like Roche 8800 equipment which can do thousands of tests in a day. We should immediately try and procure them for the country. Unfortunately, there's not a single equipment there which can do thousands of tests per day. At least 2 of such equipment should immediately procured and go out here, or slightly lower models if they're not available, and made available to the public.
Right. Dr. Kang, last question for you. Sorry. We've heard in Germany and many other countries, they are taking 16 samples, mixing it, and then checking if there's a virus. And if there's no virus, one test can clear all 16. That's called pooling, and it's common. Is that very difficult to do? But it seems to me, 1,800 rupees for 16 people is not bad.
Well, actually, pooling is something that is very useful when you have a low prevalence of infection in the population.
Right.
Once you get up to a considerable part of the population potentially infected, then pooling loses its value because you're going to have to go back to the individual samples if your pools turn out positive. So to start with, yes, absolutely, pooling is a cost-efficient way of testing a lot of samples. Later in the course of the epidemic, that might not be the case.
Right. Thank you both very much, and salute to both of you. You are at the front line. Please be careful. I hope you have all the protective gear, and it's not in short supply.
Please provide us more. We need it.
Everybody needs it. Yeah, all medical staff need it. Yes, it is a crisis, and we have to face that and crack that crisis. That's one thing the government must do. But thank you both very much indeed. Now we'll move on to the data that you are producing, testing data, and how economics can actually use that data and make policies that have an impact and then win this war against the coronavirus. Thank you very much. Joining us is Professor Amartya Sen. Thank you very much, sir, for joining us. It's wonderful to have you. Now, we all keep saying that this is a terrible crisis, and then we say it's like a war. But it's not quite a war. There are differences between this and full-scale, guns and weapons. There is an enemy. What are the differences between this and a real war?
The difference is that the war is fought with a single unified leadership. It could be Napoleon or Stalin, somebody who decides what is to be done. And the war analogy is a bad one because in a country there are divergent groups, there are different interests. Some people are concerned primarily, almost exclusively, with stopping the COVID-19 spread. Others are concerned also about where their next meal is going to come from. So if in the process of lockdown you do away with a lot of people's jobs, And we know even that's how famines also come, lack of income, lack of ability to buy food. Then we'll end up in a state where there will be a lot of death from hunger, and certainly a lot of suffering from it, but death too, I think. And so what we need is a cooperative approach. The war is never fought on a cooperative footing. So I think the war analogy is not right.
Right, there are huge differences, absolutely. And if I can bring in Kaushik Basu, who was my colleague at the Delhi School of Economics, and that's all that matters. He went on to be professors here, there, and everywhere. But Delhi School of Economics is what really matters, Kaushik. Now, Kaushik, the crisis that we are focused on so much, we keep looking at the virus and how to control it. But there's also this lingering feeling, maybe among economists like you especially, that there's a trade-off between the coronavirus killing it and controlling it, and controlling and doing for the economy. That in trying to save lives from the virus, we may be losing lives on the economy. Is that a trade-off? Is that the balance one should be looking at, or at the moment focus on this virus and baad mein dekha jayega as far as the economy is concerned?
Prannoy, first of all, glad to be talking to you. I hope wish we were doing it under better circumstances. Going back to your question, as soon as questions about the economy are raised, people immediately say that, look, this is the time to talk about lives, not the economy. I feel posing it in those terms is getting it completely wrong. It is lives versus lives. In the end, if the economy crashes, that can take a toll, and we know from history it can take a toll which will fully match up to a pandemic. So it is true that as you are trying to control the virus, and India has taken some early steps, and there was a lot of problem in the fine-tuning and management of that, but important steps have been taken. What we have to keep a watch on is that this lockdown does not bring the economy to a grinding halt, because then, first of all, the biggest suffering will be on the masses, the poor people, the migrants. It can be huge. But number two, you can have the rupee collapsing, which is going to bring the entire economy into a grinding halt with lives being lost. So the question not is it this or is it that? It's a question of how do you control the virus, keeping an eye continuously on the economy so that things don't fly out of control.
I'm so relieved you didn't say ceteris paribus, at least. But that's very, very accurately put. Thank you very much. And joining us now is the brilliant professor from Stanford who's written a lot about this subject, Amit Seru. Professor Seru, you've been writing and studying this pandemic very closely for quite a while. Just tell us what we can learn from America, from the huge package that you had there, and what lessons are there for India, which are the early stages right now?
Thanks, Pranay. Pleasure to be here. So I think from US, there are a few things that come out. As you know, US has spent right now about $2 trillion towards trying to address the pandemic crisis. So that's like 10% of the GDP. Now, when we studied this, and I did this with a colleague of mine, Professor Zingales from Chicago, what we found was that this seemed a little bit excessive than what was needed immediately, because the issue with the pandemic is that if you don't intervene, it's going to wipe out a significant part of the elderly population. And so therefore the lockdowns. But if you do a lockdown, it destroys the livelihoods of younger and poorer people. So you need some redistribution. The question is how much and what's the most cost-effective way of doing it. And we argued that if you went for wages of employees directly and tried to prevent the disbanding of companies, that's a much more cost-effective way of doing this, rather than what Trump administration has tried to do, which is bail out companies and try to see if the companies would then follow a trickle-down strategy and get the stimulus down to the employees, and that typically doesn't work. So we try to argue that there are more direct ways in which you should be providing subsidy. So that's one thing that emerges.
I just wanted to ask you, would you suggest that for India, there should be direct payments for people's wages to save jobs, save businesses? In America, they're giving money directly. Of course, they give much more. Should India be giving workers that have lost their jobs, individuals who are self-employed, daily wage, who are just on the streets without any future, no presence either, no present? Should the government be giving them a daily wage and food and let them survive through this crisis?
I think it's needed. If I look at India's current plan, it's sort of budgeted about 1-2% of GDP, and that seems too little. They got to think this is a war. It's a war against an invisible enemy, but it's a war, and it's going to be a long battle. So you want to direct your resources towards the most vulnerable. And one way of getting that done is try to preserve employees working in firms, to try to prevent disbanding, unemployment. And the other is ramping up the subsidies that needs to get to a lot of the people who are in the informal sector, because that's a big chunk of Indian economy, as you know.
Right, let's go back to Arvind Subramanian. You've done a lot of research on this as well. You've written a paper on this and many articles. You know, why is India different this time? You said that this is a crisis is big and it's different from all the rest, but how is it affecting India, and what makes India different from the rest of the world in tackling this?
Thanks, Prannoy. I think there are 2 or 3 kind of aspects which are kind of peculiar or distinct to India. First, I think, Prannoy, we should all remember that this crisis has hit India, the Indian economy, at a time when the economy was already slowing very sharply. You will recall in December, you and I spoke, and we saw all the indicators. The economy was actually, and because of problems in the financial sector, what we call the 4 balance sheet challenge, the economy was already slowing very rapidly. So the coronavirus, the COVID epidemic, has come on top of that, which is why I think the Indian economy is a bit more vulnerable than many other economies in the world. Second, I think that our medical infrastructure is relatively weak, so our ability to cope with the health dimensions is also going to be a little bit weaker than other countries. But I think the third aspect, which I think in which India is different, maybe at least compared to the advanced economies, is something that Professor Sen just spoke about. See, we have a lot more informalization of the economy. 70, 80%, maybe even more workers are the informal sector. So our ability to reach them, as it were, and cushion them against these shocks is going to be much more difficult. Now, one dimension of that we saw playing out, on the TV screens and so on, which was kind of a little bit of a revelation to all of us, is that when we speak about, the vulnerable segments of the population, we had kind of overlooked that there is this huge group, the migrant workers, who I think do so much to keep the economy going, but we suddenly found that, they were extremely vulnerable. And so that's another dimension of this. So in a sense, what Kaushik just said, that the whole lives and livelihoods debate that we're having, I think that becomes a little bit more salient for India because people are so much poorer, so much more vulnerable, that not addressing the economic dimensions of this means, the costs are going to be much greater. That's why I think, keeping both of that for a country like India, which is more vulnerable, less able to reach out, more informal people, I think the safety nets are weaker. Therefore, I think it makes it a bit more distinctive for India, a bigger challenge for.
Yep, good point. It's very important points for India and the policies that we take to fight this particular crisis. Let's have a look now at what people are saying. How bad is this crisis? What are the forecasts for the global economy? What are the forecasts for Europe and India? Well, first of all, there's a massive negative swing in global GDP. That is what the forecast is. The current forecast is that the GDP before the crisis, global GDP, we're using actually G20 figures as a proxy, global GDP or G20 GDP was forecast to go up by 2.3% globally. That was before this crisis. And now, after the crisis, just a couple of months later, is going down minus 2.2. That's a huge swing. That's a swing of 4.5 negative. And you can think of how many hundreds of billions of dollars in losses that is. 2.2, two ways to look at it. It is a recession, terrible recession, but it could have been worse. Many people kind of think it could have been much worse. But this is the global kind of picture. What about if we look at it Europe first? If we look at region by region, it's a bit different. For example, and this is a forecast by the Economist Intelligence Unit, and it says India could be growing higher than other countries. Let's have a look at what it says about the forecast for Western Europe in 2020. Down 6%. Now that is, it doesn't seem much, 6%, but it's huge. And by the way, all these figures can change within the next 7 days, next 10 days, next month, 2 months. But that's the current best forecast. -6 for Western Europe. Most badly affected. What about America? America, pretty bad too. -2.8 for a huge economy like America. That will have repercussions right across the world. Crucial to realize that -2.8 may not seem much, but the economy is so large that it will have a major impact. China, the current forecast is that it will actually grow by 1%. Now, that's terrible for China. It's used to 6, 7, but 1% is terrible. It's a swing down of 4, 5, 6%, but not disastrous. And what's the forecast for India? That India will drop to 2.1%. 2.1% positive growth rate makes it one of the highest country forecasts for 2020-21. I mean, till fiscal year 21. I think only Brazil is 2.3, but basically India is higher than many other countries. And I can just quickly ask Arvind Subramanian, are those credible figures, do you feel?
Well, I think, as you said, Prannoy, there's a lot of uncertainty around all these numbers.
Yeah.
Not least because, we don't know how long that's the uncertainty I spoke about, how long the pandemic is going to go, intensity, but also how much longer the social distancing measures will be kept in place, and that's going to vary from place to place. I just want, just to, instead of giving actually a forecast, just to give you a sense of how to think about this. Let's say the forecast for India is 5% or was 5%, for next year before the crisis began. We need to do the following thought experiment, Prannoy, right? Supposing we say that we lose 1 month's GDP because of the lockdown. Let's say, you have essential and non-essential sectors. Essential sector is, let's say, half the economy. Non-essential is half. So let's say the non-essential sector we lose for 2 months, let's say, very kind of conservatively. So right. If you lose 1 month's GDP, a 5% forecast becomes a negative growth forecast. So I think that's the way I think we should think about this rather than, any specific numbers, or put differently, as policymakers, we should be prepared for and act as if those numbers, even for India, could be much worse than what these numbers are saying.
But Arvind, if I could just ask you that when it says a forecast, and this is by a pretty credible organization, of course, when it says 2%, you feel, okay, that's not too bad. Maybe I can push the economy a little more and give people more wages, money, food, etc. Because I'm not in -6. I can perhaps afford to lose another 1%, another 2%. But you're saying don't take that 2% for granted. Is that right?
Yeah. Don't take. But then, Prannoy, I would say that even if it's, how much we need to do at this stage should not be determined by whether it's going to be +2 or -2.
Very good point. Very good point.
We need regardless.
Right. In fact, let me get Kaushik on this as well. Kaushik, people are talking about, don't worry about the budget deficit, forget about it, forget the deficit, forget the foreign exchange reserves, forget all that. Just relax a bit right now. Focus on the virus. Do you agree with that, or should we be worried?
I agree with that.
Right, you agree with that. Just could you elaborate on that a bit?
Yeah, I agree with that. The fiscal deficit is something that we will have to just look the other way for, say, 6 months, and then we can begin to correct it. So if it is a question being raised that should we be sort of strung up about keeping the fiscal deficit under control, my point is no. But the economy has many other things apart from the fiscal deficit, and we have to keep a very, very close eye on that. And really, we will come to suffer not 6 months down the road, but 1 month down the road, 2 weeks down the road, if we don't keep that watch.
Finally, actually, if I could get back to, on this topic, to Professor Amartya Sen. You've been looking at this and you've got the experience of looking at so many different crises. What are the lessons that you're already taking away from this? The lessons that may change in a little while, that what will come out of this? And what kind of future are we heading towards? What lessons?
I think I would emphasize two in particular. There are many lessons. I'm not that worried about the economy bumping back. The economy will be very badly affected, partly because of the lockdown itself. But the Indian economy is quite resilient, and it will come back. We have an eager labor force. We have good entrepreneurs. So that will come back. I think the problems are, one, the complete neglect of health care, which has predated the present government, but it's certainly gotten worse under the present government. So I think we need to spend much more on health care, and particularly primary health care. Not when you have special illnesses, go to a hospital, perhaps a private hospital, and government will meet the bill. I think what we need is an infrastructure of primary health care. India doesn't have it. China has it. Korea has it. Taiwan has it. And in fact, all the countries that have dealt with the crisis well and also raised the life expectancy and lowered the morbidity rate of the population have, and India doesn't have. It's a perennial neglect which has to be remedied. I think same could be said to some extent about education, though there is more happening. There's more reliance on private education in India than is justified. I think we need much more public schooling in a way that every country, from the United States to Russia, no matter where you stand politically, has done, and not to mention Europe. And that's to be done. I think these two, but basically also this idea that a lot of crisis is not a war. They are reasons for a cooperative solution. Being anti-government is not being anti-national. The understanding that a democracy has a good reason for cooperation, even when it's not immediately obvious why it's needed. It's needed because that's how democracy is successful. So these are lessons I would say we should take away from this. And, it's a big tragedy, and we can do, all of us can do our best in a cooperative way to have a successful COVID-19 suppression program, because left to itself, I do take the view that it will be a very big calamity in India.
Right. And I think, remember, you were the first person who pointed out that famines were actually the whole trend, and famines after famines were stopped because of democracy, because of the media highlighting there's a famine, and then authorities having to do something about it. So this is very important, that democracy can help. And if the media shows there are pockets of areas or neglect, the authorities will react. If we were kept under and hidden, you'll have the same phenomenon as you had in famines, where authorities don't have to worry because nobody knows about it. So it's a very important point. But just going back to how bad is this crisis? I mean, we talk about a war, we talk about earlier pandemics, but actually it may not be as bad as earlier wars or the great influenza pandemic of 1918 to 1920. If you look at World War I, what was the impact on GDP? The negative growth impact of influenza first. The influenza minus 6% was that globally. Of course, it was a very different time, different technologies, but that was the impact of the global influenza pandemic. What was the impact of World War I? Minus 8.4. So it was pretty much more serious in terms of economic growth than what is being forecast right now. But let us keep giving a health warning that it is a forecast. The forecast for COVID-19 for 2020, as we mentioned, minus 2.2. So compare those three figures. People say, oh, this could be like World War III. It's actually better than World War I. Better is not as bad as, put it that way. Right, going to Amit, again, you gave us some very useful pointers actually for any government policy. A couple of other points in the sense that some of America's 10% of GDP is spent, India's is just 1%. How much do you feel India should go up to? We're just allocated 1%, America 10%. We can't match the resources, but can we match at least percentage of our GDP? But given, remember, that our economy was not in very good shape before this whole thing started, it was slowing down a bit. Maybe we're a bit more vulnerable. How much does one have to be prudent versus take this crisis on like a war, as you say?
I think India's economic situation, there has been a slowdown, and the banking sector in particular was floundering a bit with the NPA problem. So it's not in the best shape to necessarily pass the stimulus on to the real economy, in all honesty. So one needs to think of more creative ways to get this done. I think if I do the numbers right, somewhere around 5% of GDP would be needed for sure. And like I said, you might worry about the fiscal deficit and what implications it might have for inflation in the future and on the currency. But the good news is, if there is any, that every country is facing the same problem. So it's not clear that if investors pull away from India and other emerging economies, where they would want to go if they want to rebalance their portfolio. So we can take that in our stride and be a little bit more aggressive in terms of doing the stimulus and other things, because we need time. We need to find time to build our capacity, hospital capacity, because that's essential. That's where the crisis has started. And if we flounder on that front, it will be a problem. It'll be a much major problem and will cost us way more than what we are anticipating right now.
Right. It's a very, very tough choice. And if I go back to the sensible, safe pair of hands of Arvind Subramanian, what should India do now? I mean, we've had some positive steps. The lockdown was great. The stopping of flights coming in very early, that was great. Many people, and it's very clear that these are delaying, it's not curing the problem, but it is important to be prepared for what happens after the lockdown. What are the steps that India should take now?
Yeah, right. Firstly, I think, Prannoy, just kind of, it's important the words that we use. I don't think we should be talking about stimulus at this stage. This is not remember, this is an unusual thing. It's not that, economy is down, we want to bring it back up, because by definition, we can't bring it back up. So I think that's not, and I'll come to that in just a second. First of all, I think you're absolutely right. I think the government has taken some very important first steps, both on the medical and the health side, but also on the the economy. So just work through it step by step, I would say. I broadly agree that we should probably be spending somewhere between 4 to 5% of GDP, compared to the US's 10%. And I think today, so far, the first package, at least by the government, was closer to 1% of GDP. And so I think there's more we could do. Now, the two, I think, big things in terms of what we need to do is whatever it's going to take on the health side, whether it's free testing, buying these things, vaccines, I think there should be no resource constraint on that. So that those expenditures should go up. The second, I think, is what we call the cushioning, the insurance of the vulnerable. That should also, I think, probably be ramped up. I think what the government has done so far is very sensible in the sense that social insurance cushioning, it's basically used the existing social safety net, for example, the PDS and the cash transfers to do this. But I think here is a situation where one should err on the side of generosity, whether it's in terms of how many people are covered, how much is given, for how long it's given. I think we should be much more generous. Just to give you one example, I don't think at this stage we should obsess with targeting, finding the poorest. All these Jan Dhan accounts are there, the JAM accounts are there, infrastructure is there. I think we should just be pushing money into all these bank accounts. If some quote unquote less vulnerable people also get it, I think that's worth paying the price, because if we say, only those with BPL or Aadhaar or whatever get it, we're going to miss out on a lot of deserving people. So I think we should, do that one. That's one principle. Second, I think it's kind of relates to Professor Sen's about the cooperative part. We forget that a lot of the action, the response is coming from the states. Right. So I think the states should have the freedom and the resources to spend more. So one immediate thing I would think of doing is that, remember, the states are also under this, fiscal responsibility legislation. I think, for this year, I think the states should be free to spend whatever they need to and not be overly constrained by all these, I think, fiscal responsibility things. So I think, that's something we should probably do quite immediately. And the last point I would say is that we need to depart from the playbook, the conventional playbook, whether it's, how much, the 3.5% deficit target. I think we should completely, at least put that in abeyance, at least for this year. We may need to do some money, printing of money. I think, as on a one-off basis, I think that should also be considered. Right. So I think these are the things that I think I would do, whatever it takes on the health side, whatever it takes for the social cushioning, and then pure stimulus in terms of getting back. I think we should think about that a little later. But I would also say, to be a little bit optimistic, Prannoy, is that I do think that once, we see the worst, I think the economy will recover quite sharply, quite quickly. So to go back to those charts that you were presenting, that, even if the depth of this recession globally may be greater than in the past, I'm hoping that the duration will be shorter than World War One or the pandemic.
Yeah. I mean, I can imagine the movie industry is in really bad shape, but minute the lockdown is over, everybody's going to, as soon as they're allowed to, they're going to fill. People are going to look for restaurants and a change and getting back to what they used to, and see this huge jump in demand at that time. And along with all that you've said, I think the freedom, the giving more to states, because India is becoming increasingly a federation of states, and the role of chief ministers and states is quite right. You're right, absolutely critical. And so is the role of technology. Sorry, go ahead.
So, I just on the thing about the states, we don't want to be in a situation where the states are cutting or holding back expenditure because they think, what's going to happen, will they be under some limits? I think
they are. They are right now. Yes, they are facing that, absolutely. States are asking the center for more because they're really running out of funds. And what you're saying is very important. Give much more leeway to states at this crisis. But I'd like to just move on to another whole issue of technology. That's what makes this whole crisis very different from even 10 years ago, because technology has changed so much. It has the power for businesses to continue in a crisis of this magnitude. This would not have been possible. I mean, talking across satellites, talking to each other across the internet. In fact, we've got the CEO of Cisco, one of the greatest technology companies in the world, and I will say that whether or not they were sponsoring this program, but I want to be clear, they are sponsoring it, and it's great to have them with us because technology is important. But could you give us 2 or 3 examples of how technology can help in a crisis like this?
Yeah, and thanks, Dr. Roy, for giving us this opportunity to talk. But in most other crises like this, or even if you had floods, for example, or you had SARS, like you mentioned, I think some of these things were limited to a particular region, right? It was never the kind of scale that we are seeing on this pandemic, which is like global in nature, right? 190 countries. So, typical business continuity plans are based on a premise that, you'll have one city or one state or one country impacted, but you could move your business to be handled from another country, another city, or another state. This doesn't work in this environment. So I think, the kind of challenge that we are seeing right now is unprecedented, a word which is probably being used very often in this. But just to give you a few examples, right? If you look at the IT BPO sector, right, or the ITES sector in India, which kind of employs around 4.5 million people and generates close to $190 billion of business. There were some regulatory issues which did not allow folks to actually work from home, right? So it was a massive safety issue if people in large numbers continue to work in office. So we actually had, worked very closely with the Department of Telecom and with NASCOM and Department of IT, etc., to kind of relax these norms. And again, to use the word unprecedented, they kind of did the relaxation in less than 2 and 2.5 days. And today, pretty much, I would say a large proportion of that 4.5 million people in that industry are actually working from home based on solutions from Cisco, Microsoft, and the others. In fact, 70,000 of our employees are working from home, pretty much all of them. The second area that we are seeing probably a lot of use of technology is education, right? So if you look at it, I think the UN report says school closures have impacted nearly 1.5 billion students worldwide. We are helping these institutions use Cisco WebEx to help students in schools like Indus. Most of the IITs are using it now. ISB is using it. Of course, you've seen enough and more examples of healthcare where Bombay Municipal Corporation is using Cisco video conferencing and other facilities to do this stuff. And lastly, I think the adoption by leaders around the world is kind of something that we've been very pleasantly surprised with, right? So the G20, the G7, Prime Minister Modi talking to SAARC leaders, all of this is happening over technology and adoption of digital and video communications, which we've never seen before.
Right, thanks very much. Technology is what is really going to change this entire crisis. And not just Cisco, all the big technology companies around the world are all being a great help. But I'm really happy to have Abhijit Banerjee and Esther Duflo with us, with Nobel Prize winners, the youngest ever. Great to have you again. It was wonderful chatting with you last time. But this is a crisis that none of us could have foreseen. It just is unbelievable. We've seen migrants, we've seen people hungry. But there have been some positive. The lockdown was a big decision, but perhaps it was not as planned as well as it should. But the key point is, what would you recommend that we do for the poorest, and obviously the daily wage laborers and the very, very poor who are really suffering at the moment? Can't talk to them about budget deficits. What should we do?
We were not coordinating very well. I'll start. Esther will jump in. We're in different rooms. So I think that what's very clear is that we need to get money in their hands. I think that's true even for macro-prudential reasons. I think it would be I think we were in a Keynesian slowdown, and now we're going to be in a Keynesian tailspin. And demand will go down, and therefore the incomes will go down, and demand will then go down further. The usual story, but we are absolutely a classic position to be hit by that. So there is no excuse for not spending lots of money, and there's no excuse for not giving that money to the poorest people. I mean, that's not to say that I think probably what we want is, in fact, keep firms going as well, because the transition in and out of bankruptcy is very costly. So we probably want to have policies for debt rescheduling. I would say that probably, requiring essentially no debt repayment for the near future and using, public funds to bankroll that. But in general, I think that the hard question is, how do we make sure that the money gets to the poorest people who actually need the money, who are desperate? And if we want to actually have this lockdown work, we need them to have money, because otherwise they're going to just run out on the street. You can't ask people to just starve or even to live on PDS rations forever. I mean, they have other compulsions. Life is bad enough in a lockdown, and if you give them zero kind of incentive to comply, they won't comply. I think one wants to create enough slack that they're willing to endure this next few months. Right.
Esther Duflo?
Yeah, I think Abhijit said the most important things. One way to tie what Abhijit just said and what was said before by all of your guests is that maybe we should not think of this in terms of trade-offs. Maybe we should not think there are trade-offs between lives and livelihood, because and maybe we should not think that there is even a trade-off between sustaining people today and the macroeconomy, because everything hinges on the ability of the poorest people to survive this lockdown. And when I say everything is on the health side, there is no trade-off, because after 3 weeks, if they cannot earn any money, there is nothing that is going to keep them home. Like, no police is going to be able to keep them home. So the lockdown would fail, and with it, the health consequences would immediately follow. So in that sense, there is no trade-off between sustaining people's livelihood and ensuring their health. The lockdown is necessary but it can only succeed if we have a way to sustain people's lives. And likewise, as Abhijit said, there is a great danger of the economy of the economic shock to snowball, where it starts from a demand shock where people are unable to buy anything because they don't make any money, and therefore nobody is able to sell them anything, and therefore the people who would produce what these people would sell also lose their job and their livelihoods and so on and so forth. And this snowballing would actually be the one thing that might undermine a quick recovery of the economy after the pandemic is finished, if everybody has gone bankrupt in these cycles. So we need to maintain this too. Fortunately,
can I just interrupt you a second? Based on what you've said and what earlier speakers have said, we quickly put together some points of what India should do, and maybe you could add some or comment on some of these ideas that people have made. Let's have a quick look at what are the lessons that India can learn from the rest of the world, and what should India do currently. So India cannot match the resources of developed nations like $2 trillion and 10%, but we can match some of their policies and we can learn from them. For example, let's have a look at, so far India's package has been 1.7 lakh crores, which is 1% of GDP. Now, America did 10%. We're not talking about the number, but 10%. Should we go to 10%? If not 10%, what our experts have been saying, we must go to 4 to 5% of GDP. And that is 4 times what we've already done. If we've done nearly 2 crores, say, we want to go to another package of about 6 to 8 crores, 6 to 8 lakh crores. We've done 2 lakh crores, now 6 to 8 more lakh crores. That's what we need, and we're running out of time. And that another package must come immediately. I said 6 to 8, so roughly 7 lakh crores if we are going to learn from other countries. And to be honest, America handled the last crisis much better than Europe, and they put $2 trillion, 10%. Even if we go to 4 to 5% of GDP, maybe it's a lesson to learn. First of all, out of that 7 lakh crores, massive proportion outlay on medical and health services. The front line of ventilators, equipment for doctors, preventive care for them, they are our front line. And as everybody's been saying, suspend, including just now, Arvind Subramanian said, forget all this fiscal deficit, fiscal limits, both for states and for the center for 1 year, and use monetary financing. This is going against the traditional thinking in India's economics. And we do have, everybody says, among the best economists in the world. Now, immediately disperse most of the 60 million tons of food grain stocks. Give it free to the poorest. We've got 60 million tons. We've been keeping that for 20 years for a crisis. Is this not a crisis? This is the time, and what makes it even more essential is that the harvest is about to happen. The Rabi harvest, that 60 could go to 100. So let's go down to 20. Distribute free 40 million tons of food grain. That much of it, or some of it, is rotting in godowns. Now, if we carry on, look at some other, let me just actually go straight to, here. We'll come back to that. Just a point for you, Abhijit and Esther, about these food grains. 60 million tons lying in godowns, people die. I mean, it's just, but you are the people who know how to get it to the poor. So how does one move it from the godowns to the poor?
I think that, to be honest, the PDS mechanism has improved over the last 5 or 7 years. Actually, last 10 years, I would say, starting about the late 2000s. And I think at this point, if the government announced that there would be, 7 kgs will be 14 kgs, I don't think any crisis will happen. I think the real issue is there's a bunch of people who don't actually have access to PDS. And in particular, some of these migrants, they may no longer have access to PDS in either location. I think we need to think about the people who are going to fall through the cracks. And that's why I think Arvind's point about cash transfers is critical. And in some ways, I think that the whole JAM Trinity is set up for this. We should also think of that. I think the PDS is great, but people are not going to eat, 400 kilos of rice in a week. So there's a limit to how much we can redistribute through PDS. Very clear limit. And at that point, we want to think of other ways of redistributing. I think food is great. I think your point about there being massive stocks to be used is great. I think there's some shipping issues to be dealt with without spreading the disease. So I think being very mindful of how to get the food to people is going to be important. But I think the one point that I think is worth underscoring is that while the government has mentioned which mechanisms, a lot of them involve targeting farmers, NREG. NREG is a strange one to talk about in this context, given that the people are not allowed to actually go out. So I would say that thinking of mechanisms that are available, I think PDS is one, and cash transfers is the other. There's not much else left. And right. I wouldn't worry about who's a farmer, who's not, is it 2 acres of land, 1.5 right. acres? This is not worth figuring out. We need to go, Arvind said all of it, which is let's not worry about targeting. We can, even if the rich get it, so be it. I don't see a reason for us to try to be clever. We should be fast and not clever.
Fast and not clever. And Esther, I'm going to give you another 4 or 5 points that have come up for your comments on these other points. Let's have a look at some of the things apart from the food grains and, as you say, give it to everybody. But generous cash payments to self-employed and daily wage earners. Give daily or monthly or weekly cash to them directly. We talk about India being full of entrepreneurs and small entrepreneurs. Yes, we are, but they're in a crisis right now. They're daily wage earners, and what do? So we need to give them some cushion for at least a month, direct cash, and that's what your 7 lakh crores could go towards. Going up the scale a bit, a package for small and medium-sized businesses. They're in terrible shape right now because there's no demand, nobody's buying anything. Moving on. Some countries have done this, enforce no layoff rule for big businesses, and maybe even pay part of the workers' wages of big businesses, but at least say no layoffs are allowed. It's against the law for the next month or 2. Now it's harvest time, and that's a big worry. I'm an agricultural economist and I've been around with combine harvesters, and once the pile of wheat is lying out there, getting it to the mandi, getting it to being bought by the government is a huge job. So a lot of that money must go towards paying for this harvest, because it's going to be very difficult for farmers to get money for all the work they've done for the whole rabi crop at this time of the year. And again, targeted assistance for specific industries like airlines, tourism, retail, restaurants. I'll go much more than that. Learning from Telangana and KCR and KTR, they focused on professions, fishermen, barbershops, saloons, sheep, people who have sheep. Focus on each one of them and help them out in a targeted way with all this money. But Esther, how does one go about all this? Or is it being profligate?
I think it is profligate. I think it's not profligate in terms of the amount of money that is being sent. It's profligate in terms of the number of slides of words on your slides. I think things need to be much simpler. And this is what Abhijit has been saying, Arvind has been saying. At the moment, in the best of time, the apparatus of targeting, enforcing conditionalities and so on and so forth, makes things so complicated that most people who are the most vulnerable in the country don't access the schemes. In a time where they can't even get out, then how would you want them to fill the 5 forms that are going to justify that they are indeed eligible to such and such aid under such and such schemes? This is like absurd. You have to do something simple. You have the infrastructure. It looks like India has prepared itself for years by having the GEM trilogy. People have bank accounts, people have access to phones, people have, and we have the ability the country has the ability to send money straight to them, to send money straight to a lot of people. And then there are some people who are excluded from that, say the very old people who don't have phones, and one could deliver cash to them, which is what has been decided in some states, that the old age pension is going to just physically be delivered to them. What is important is to not waste time by trying to be clever about targeting this or that people.
No, but let me just get Abhijit in here. I mean, the tourism industry, the airlines industry, they could die. Don't you feel they need a package?
They would be back. I don't see a way to say, you can suspend debt payments. I think that's the obvious way to help them right now is to just say, look, all debt will be rescheduled for 3 months. I think that's a perfectly legitimate thing to do. But I want to emphasize a point you made, which I think is not being discussed and is very important, which is where will the farmers get the labor to cut their wheat? And the rabi crop, if the farmers actually lose the rabi crop, that's going to be adding a real layer of disaster. I think somehow the government has to think through this point, which is one you're making, which is that you're going to have a harvest with no labor. It's not just a matter of buying it; it's also a matter of harvesting. Harvesting is labor intensive, as we know. And in many places, people don't have combined harvesters.
Right.
They're going to need, they're used to getting people coming and cutting them and stacking them. How is that going to work? I think this is actually a very important issue. Hasn't been discussed at all, but because it's a supply side issue that needs to be discussed.
Because the harvest is about to come, and we need to move fast on that. And I know farmers are very, very worried. Well, thank you both very, very much as usual. Incisive, and keep writing, because I read your work and what needs to be done now, from the details of how to get, you may want to get things to the poor, how to go about it. And I think, Esther, you made a point, let's not be too complicated about it, just give it to everybody and don't discriminate. Thank you both very much indeed. Thank you very much.
Thank you.
Thank you very much. Thank you. Let's go back to this whole question of technology, and hopefully it'll be a kind of savior, or at least better than it would have been 10 years ago or 20 years ago. Once again, thank you for joining us. Tell us any way you can think how technology can keep workers both safe and productive at this kind of time.
No, you're absolutely right. Even we were, kind of working towards figuring out how solutions will continue to help our customers and our partners and communities to stay productive. And I'll give you some numbers before I go into the safety aspect of it. Let me talk to you a little bit about some of the productivity numbers, right? Now, globally, the usage of telecommunications products like WebEx or tele-video conferencing facilities like WebEx has gone up between 2x to 5x depending on the country, right? Globally, we've seen 73 million meetings, 14.3 billion minutes of video conferencing facilities being used. After the US, India is actually number 2 in terms of usage, right? So if you were to look at our February numbers versus our March numbers, and if I look at those numbers, I can safely say that people are being productive, right? We had a little less than 6 million participants in February over our Cisco WebEx. In March, we had 20 million participants. So that's like 2 crore people were on WebEx at any point in time or through the course of March. In February, we had like a little less than 35 lakh people, 35 lakh meetings. And in March, we've had 60 lakh meetings or 6 million meetings. So obviously, people are adopting this technology, and I'm sure other technologies similar to ours, in a size and scale and of transformation which is completely unprecedented. Because, frankly, we have not designed our products to say the world will start using them. The entire world will start using them at any point in time. So we've had to actually build that up significantly. The other thing that we've noticed is that, of course, personal safety, physical safety is very important. But cyber safety becomes even more important when you have this scale of digital usage, right? So we have ensured that we give away free cyber security offers to our customers and partners in this time for protection of from malicious websites, to ensure multi-factor authentication, VPN, etc. So I think there's an element of personal safety for sure, with constant messaging around washing your hands, keeping yourself hygienic and stuff like that. But I think productivity has significantly been maintained, if not improved, because of this. I don't know about you, but I'm actually ending up working a little bit more while I'm working from home than I used to when I was not.
Quite true, actually. It's that's the depressing part. We have to work harder because of your tech. That's not fair. But we travel around the world and look at many tech startups, and we're looking at how they are developing new solutions, technology from health, for example, just on your mobile phone. And we've heard of all these new tech methods of testing. What new models of working and operations do you see that's going to come after this and will change forever after we've tried this and found, my gosh, this works and we don't have to do what we used to do earlier? We weren't thinking enough. How will things change?
No, I think that is probably one of the biggest questions that most folks are talking about. In fact, I was on some calls with some senior bureaucrats, and if you look at, let's say, the kind of infrastructure that our top cities have, the traffic issues that we have, etc. I think this has kind of taught us that there is probably a solution for aggressive work from home. Even after the COVID situation gets over, right? And kind of reduce the stress on the infrastructure on our cities, right? I think bureaucrats and politicians will probably definitely look at this as a new way or a new normal to reduce the infrastructure pressure that we have today. The second thing that I'm sensing is that I think clearly, India has always had a shortage of doctors. India has always had a shortage of medical equipment and so on, number of beds. I think the use of telehealth has been very aggressive in these last 30, 40, 50 days, right? And I think, there always was a worry whether this solution of telehealth will scale. I think it's shown that it does scale. And I think that is something that will probably, in my opinion, become a new way of delivering healthcare. The third area that I'm seeing is clearly around, more aggressive usage of drones, more aggressive usage of sensors for vital information to be collected remotely. Maybe even self-driving vehicles will get a spurt. Because you will see delivery of supplies to medical workers being used in places like Wuhan, etc. So I think you will see a massive change in certain industries as a result of this.
Yeah, I totally agree with you how tech is changing the world in so many different ways. It's fantastic, and to see young kids like you making these changes is great to see. India's new generation much better than ours. But moving on from tech to another industry which has been actually quite infected by tech and changed a lot is the banking industry. And we've got the chairman of the State Bank of India. But amidst all this financial crisis, sir, there is a real worry. People are worried that some banks may collapse. You know, we've seen that in earlier crises. It's just, are we going to see banks collapsing, especially the smaller banks and some private banks? Will we see them collapsing? And then will people lose all their money? Or is that just not correct and nothing to worry about?
Right. Let me give you a little bit of analysis of the situation. One is that when there is a lockdown for, say, about 3 weeks, there is definitely an impact on the economic activity. And when there is an impact on the economic activity, that gets reflected on the financial system of the country. And if I compare this situation with what happened in, say, 1997 or 2008, the problem was creation of the financial system. This time, it is not a creation of the problem by the financial system. And when we are in a situation where there is an output loss or economic loss, even though temporary, but everybody, whether it is the governments on account of revenue loss, the elevated stress in the sectors of the economy, say, for example, the tourism industry, the restaurant business, the aviation sector, there is an impact. Some sectors will be impacted more, some will be impacted less. And a part of it will be impacting the bank's financial system. Now, if we are talking about the soundness of the financial system, we must give credence to what RBI governor said last week, that India's financial system, including private sector banks, there is no cause for worry. RBI is closely monitoring and watching the situation. And in the past, RBI has always taken steps to ensure stability of the financial system. And even in this scenario or unfolding scenario, I'm sure that government, Reserve Bank of India, and banks themselves will take all necessary steps so that the financial system stability is ensured.
Right, as long as you're focused on that. But I think an average small and medium-sized businessman want to know, will they have to pay their loans, or are they going to get this 90-day window? Is there a relaxation on the interest on that? They won't pay interest for 90 days, but when at the end they'll have to pay interest and interest on interest, or what is the current policy?
No, Reserve Bank of India has already said that at least for a 3-month period, 90 days, if people are unable to pay their installment or interest, there is a deferment. There is no waiver, but there is a deferment. So what happens, the impact is that otherwise, if there is a default of, say, even you are overdue by, say, 6 days, 10 days, or 1 day, so that starts impacting the system. So at least for 90 days, the people who are unable to pay because of the disruption in cash flow or loss of income, to that extent, there is no adverse impact on them in their credit history. This gives them some cash flow to reorganize, and then case-to-case basis, our relationship managers, they will be discussing with the businesses. They have already started reaching out to all the businessmen, and whatever are their needs, we will make an assessment. RBI has given certain relaxations. We will make full use of those relaxations. And as I said, that the approach would be to help the businesses as much as possible within the regulatory framework.
Right, sir. Thank you very much. Relatively clear. I think more and more details will come out. Now for just the last question, I'll go back to Kaushik Basu. Thank you so much for staying with us. Now, during this lockdown period, people say that the main thing you've got to do is prepare, prepare, prepare. So are there any specific thoughts you may have, and what measures that one should take the minute the lockdown period goes away? which is not too far now.
Yes, actually, I have several suggestions, and I've been going back and forth with friends and economists around the world. I've just been corresponding with economists in Israel, and I do have suggestions actually on these. Number one, on which steps are already being taken, but I have a fine-tuning idea. Reaching cash to the poor, to the masses is important, but it may not be enough. And we know this from historical examples like the Bengal famine. If you give cash to the poor, and if food goes in short supply, they will be outcompeted because food prices will rise to the point where the poor are unable to buy. So this is a time where there has to be a lot of emphasis on direct support. Provide food to the poor directly. Provide health services to the poor directly. And I have been among economists relatively conservative on this historically, that generally it's better to give cash. But in times of crisis like this, the support has to be direct and you have to reach it to the doorstep. And India is in many ways sophisticated enough in crisis that we can do a minimal amount of that. Number two, can I go through? I've got three suggestions actually. Number two, the transport lockdown and this kind of a lockdown actually maybe to start with the right thing to do, and India has started early. But 3 weeks down the road, we have to begin to move. You have to have minimal amount of people moving by trains and planes, and we have to have intelligent rules, and we can think of novel rules. Allow airlines to fly, but have a rule saying that no plane can be more than 25% full or half full. Every second seat has to be empty. These kinds of simple rules will bring down the risk of a transmission in the plane hugely. At the same time, not lock down the economy totally. People will begin to move, goods will begin to move, small businesses will start up. And similarly for trains, you have to allow this to move, because otherwise 2-3 weeks down the road, we will feel supply chains breaking down, shortages emerging. Number three, employment is a very big concern. The US Fed has done, one of the branches of the Fed, I think it's a St. Louis branch, has done a study now predicting that in this quarter, unemployment will go to over 30%. 32% is the estimate. If unemployment goes up, and actually, why did I put in the if? Unemployment is going to go up everywhere. You have to, again, have innovative ways of managing this so that small businesses don't go out of control. And we have actually good examples coming out from Denmark and from Britain, United Kingdom. And in the United Kingdom right now, the Chancellor is an Indian, Rishi Sunak. Steps that they have taken is government stepping in to tell firms that we will provide a part of the salary of your workers, don't lay them off. So a part of the salary is being dished out by the government, and the fiscal deficit is therefore widening at this time, but employment remains more or less intact, and it's not just a dole being given out to people. These three are just examples of innovative ways in which we have to think, and at the end of now, barely 2 weeks, less than that, we have to start on these immediately.
Right. Kaushik, in this lockdown, you're clearly thinking a lot for once in your life. Excellent points. Thank you very much indeed. Thank you. Well, that's all we have time for. We'll be doing the more corporate and business-related micro analysis sometime later. But for now, let's just quickly summarize what everybody's been saying in one graphic about what the government should do now. Learning from other countries, learning from what all our experts have been saying, what should India do now? What should the Indian government announce immediately? First of all, we can't match the resources of $2 trillion of the United States, but we can learn that from that. We can learn that from those policies. So don't use the resource that we don't have the resources, we're a poor country, as an excuse not to do it. We must do something, and it must be very big and very different. So far India's package is about 1.7 lakh crores, let's say 2 lakh crores, which is 1% of our GDP. We need to raise it to 4 to 5% of GDP. That's what all our panelists say. Not 10%, although some even said hinted at 10%, be like America, who seems to get out of crises better than most other countries. But 4 to 5% of GDP is a huge difference from from the 1.7 lakh crores now. What does it mean? It means, in fact, another package announced immediately of 7 lakh crores. Not 1.7 or 2 lakh crores, but 7 lakh additional crores. And then we'll hit nearly 4 to 5% of GDP. And that package can have, first of all, a massive outlay on medical services, make testing free, give protective gear to our frontline, import medicines, import ventilators, the works. Moving on. Suspend fiscal discipline limits for now, especially for states who really are at the front line, working much more directly with people, because India is becoming a federation of states. And even for the center, let's not stick to our 3.5, 3.7%, and use monetary financing. Break away from the shackles of the past. Move on. Immediately disperse most of the 60 million tons of food grain stocks that are lying in godowns. Give it free to the poorest. Give it free to everybody. As Abhijit Banerjee was saying, let's not look, give me your Aadhaar card, I'll check whether you deserve it or not. Just give this free for the next month at least. And a harvest is coming, you won't even know you've lost it. Generous cash payments, crucial, as Kaushik was saying, to millions of self-employed and daily wage earners. They've got nothing, no alternative. They're just looking, staring at a ghastly future. Something has to be done, and we have hundreds of millions of them, as we saw what happened to all the migrant workers. Then a package for small and medium-sized, small shops, small barber saloons, all these small businesses who really have 4 to 5 workers. What do you do about them? They don't have great savings. We need a package for each one of them. Many countries have done that. Enforce, as Kaushik was saying, a kind of no layoff policy by big businesses. Pay part of the workers' wages of those businesses if necessary. Let the workers be employed and not lose their jobs, and let those businesses not shut down. Now, we discussed this. Harvest time is coming up, actually is on us. So we have to have a package for buying farmers' crops. Otherwise, they're just going to be, going to waste and rotting, and all the farmers will die of starvation. So, package for buying farmers' crops is crucial, and how to get workers and laborers to harvest the crops. We have to think of that. Then again, targeted assistance for specific industries, of course, like airlines, tourism, retail, restaurants, that this particular crisis has hit specifically through no fault of theirs. But more than that, look at different professions, the smallest, barber saloons, shepherds, people who look after cows, people who are just doing small bits of work, managing a daily existence. We have to target them and give them specific help carefully and generously. Let us not hold back on generosity at this time. Well, thank you all very much for being with us. I do want to say that whatever we said, what we said last week remains. Our health workers. God bless you.